chickens, Achilles tendonitis. Well, besides having studied it, I suffer from it myself, so I know very well what I'm talking about. I'm going to explain to you a strategy that you can do on your own at home to start mitigating this limiting pain. Guys, easy, quick definition. Tendonitis, okay? That we've got the soleus muscle that caps off the back and the two little heads of the calf that come to the Achilles tendon, which is this part right here. Remember that? Achilles tendon, Brad Pitt, how handsome? Well, they stuck an arrow into his Achilles tendon and they left him dry. It's true that it's a little bit like being shot with an arrow. The sensation of pain originates from the tip of the toe, causing a significant constraint, particularly during the initial steps taken in the morning. It is imperative to go through a warm-up routine before any movement becomes feasible. We have the soleus and the calf, let's say, that are born from up here, come through here, and reach the tendon. It tapers off the back and comes to the hamstring. And the little twins come together as well. Okay? Facially, with the tendon, making the Achilles tendon, to what is the calcaneus. The initial stage of treating Achilles tendonitis involves distinguishing between the tendon itself and the nearby bursa, as it is often difficult to determine which is affected, if it is literally the tendon or what it is. We have to do an MRI or an ultrasound. The exploratory test is if you walk around and you have pain over the tendon and you touch the tendon and it hurts, almost 100% it's tendonitis and it's nothing else. One thing we are going to do is ice application, guys. We can apply ice directly every 2 to 3 hours a day to any point of pain, whether it is here, lower, or higher. This method shouldn't deviate from the original by more than 10, directly over the painful area. We will have to protect it with a cloth. Why? Because if not, we can burn the skin by excess of ice. Please be cautious when repeatedly using ice, as it can have negative consequences due to excessive usage. The beneficial effects of ice can be achieved by using it for a duration of 10 minutes. Every 2-3 hours has an analgesic and anti-inflammatory effect that is going to be vital to help us to assist in our efforts to overcome our Achilles tendinitis. Achilles tendinitis. How to treat Achilles tendinitis and alleviate the pain. A thorough diagnosis recommends limitations in physical activity and the avoidance of striking the heel. Implementing these home treatments can be beneficial. Apply ice, strength exercises, and stretching. Also, avoid a flat shoe, walking barefoot, or wearing a very high heel. Second phase, guys. Well, understand a little bit why this is happening. There may be a muscle weakness that causes the tendon to suffer. There may be poor load management, that the foot biomechanically is not moving well and causing problems in the tendon. We can be overweight. We can have an excess of tapping or repetition. Take a good look at it, because we need to know where the shots are going, okay? In this phase, what we're going to do is we're going to do a massage all over our calf, taking away the muscle tension so that the tendon doesn't suffer so much. Bam! Nice and clean. We're going to sit down. Simple position. Quality cream to give us a little massage for 3-5 minutes. We rub our hands a little bit and with a massage. That is the palmitas. One comes, the other goes without losing contact, mobilizing all the musculature, calf, oil, and flexors of the sole of the foot. The usage of our foot is helpful, right? Then we proceed to move, repeating the action for a duration of 2 or 3 minutes. Subsequently, we can escalate our technique slightly by clenching our hand into a fist. Let's put this little fist, this little knuckle, close it, okay? We do a little bit like this, and now we put the two together, and we go up, we go down, making a little bit more force, okay? This technique aids in alleviating excessive muscle tension, which could hinder the muscles and prevent them from performing optimally. Apologies, may I loosen that tendon slightly for you? Can we use a massage gun for the hamstrings? I received many comments about this. Is it possible to use the massage gun to treat Achilles tendonitis? Surely we can give it a try. What approach should we take? Once again, for a duration of 3 to 5 minutes, we would utilize our massage gun and perform the following activities. Making passes from its origin to its insertion. We can even tap the tendon a little bit, but as long as it does not generate us pain, okay? Or worsen our symptoms. As you can see, doing up and down smoothly all over the muscular. This song that I hear a lot in comments is, how do I know if I have Achilles tendonitis? Guys, toe to toe, it hurts. First steps in the morning, it hurts. It's hot, it's swollen, it's kind of red sometimes. the sensations in the tendon are also throbbing. Therefore, these are the essential indicators for identifying the presence of it, Achilles tendonitis. We are now going to do 3 exercises in this third phase, and the first one is extremely simple. We're going to put a cushion under both ankles, we're going to do with both feet, and we're just going to do for 1 minute. Flexion extension, bringing the tip of the toes towards us, lowering our fingertips as much as possible, employing a fluid and seamless motion. Rhythmic, calm, that does not represent pain in the tendon. If it represents pain in the tendon, what we will have to do is to go down less or to go up less, or go up less. We are going to do this for 1 minute. What are we going to do now? We are going to open our legs a little bit, and we are going to bring our feet outward, inward, outward, inward, generating a gentle back and forth. What we want is to mobilize the structure of the ankle, which is tremendously related to the problem, the Achilles problem. Once we finish the inward and outward exercises, take a 1 minute break. We're going to do circles to the side. 1 minute. That's it. Both feet, and so the work that one does is done by the other. We switch direction every minute, either clockwise or counterclockwise. Clockwise, counterclockwise, to mobilize well what is our ankle, which is tremendously necessary to continue with our exercise. Let's understand the exercises we are going to do next as eccentric. The eccentric, we are going to define it as I take a beer, I take it to my mouth, and I take it to my mouth concentric. If I leave it in the air, isometric, and if I drop it, it is an eccentric phase, eccentric exercise, elastic band. Let's put our little foot on the elastic band. We're going to grab it with our hands, and as I said before, we're only going to activate the rubber band in the motion in which we lengthen our muscles during exercise. So we put our foot down without tension, okay? And now we pull a lot of tension, and gradually, little by little, step by step, bit by bit, gently, unhurriedly, sedately, unhastily, at a leisurely pace, we take the tension off, we put our foot down, give as much tension as we can, slowly, 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 slowly. One way to initiate an eccentric workout is by using this method. The calf is a tremendously powerful musculature, and now we are going to do the eccentric phase standing up, which is going to help us to start to fight back against that Achilles tendonitis. Remember, this exercise cannot be done if it gives us pain. How many times are we going to do it? Performing any strength exercises, such as doing 3 sets of 10 or 15 repetitions, depends on our strength capacity as well as the inflammation level in our Achilles tendon. If we are very inflamed, we will be able to do it little, or we will not be able to do it if we are in a phase in which we can do the exercises, 3 series of 10, 3 series of 15. Eccentric exercise. This is the exercise. There are steps we need to take in order to eliminate tendinitis in the body, primarily focusing on eccentric exercises targeting the affected tendon. As you have seen 4 planks, who doesn't have a step at home? We are going to get on it, and we are going to define it as follows. We are going to put our feet at the edge of what is the step. We go up, using 2 legs, leaning more on the healthy leg, we slowly rest 1 foot on the other and descend at a progressively decreasing pace. Leaving this one up, and we go down slowly, slower. We support this foot and we go down, we go back up, subimos apoyándonos más con la izquierda, los dos arriba, we recruit the calf más well, we lift the leg, and let us drop as far as we possibly can, never stopping, as far as we can. That we suffer pain here, then we would already support the foot. You cannot do this exercise with pain. The eccentric exercises are therapeutically, they are designed to help us to work on what are all the problems of tendinitis. So 3 sets of 15, which is going to be one of the exercises that is going to carry you through and help you get rid of your Achilles tendinitis. 4th phase, stretching. Be careful to do this in the first few days of your Achilles tendonitis, because if you have a lot of inflammation, you won't be able to stretch. Inflammation, you will not be able to stretch. It stretches without pain. 2 times 40 seconds. We're going to hold against a wall, and we're going to do the calf stretch. The calf stretch. All right, orienting the pelvis to the wall, straight leg, and without lifting the heel, we're stretching our calf. There's the soleus that covers the back. We have to do an inhibition of the calf, and it's as simple as taking a little step forward. As we proceed, we remain seated on our heel, propelling ourselves forward once again, generating a stretching, a shortening of what is the calf, and a stretching of the soleus that goes to the head of the fibula. And in this case, we make a double stretch of a structure that anchors in our tendon of is anchored in our Achilles tendon, and it is tremendously fundamental. Practicing 2 sets of 40 seconds for each exercise is beneficial for our Achilles tendon, eventually leading to its improvement. And how long does Achilles tendinitis last? Well, at least 3 months at least when the Achilles tendinitis has set in. It is true that in those 3 months the pain diminishes and becomes something much more bearable, but until it recovers. But until it really recovers completely, a cellular recovery so that we understand each other, it can take from 8 to 12 months. It depends on the treatment you do, it depends on the exercises you do. Do you want to know a treatment that we gave to a patient named Raul with shock waves that went tremendously well? A video testimonial? I'll leave it right here above. As I always tell you, come and see us at the clinics. You have online appointments that we leave them in the description of the video, and to healing and beyond. Bye, bye, bye.